This is Damien, Peyton, and Kirsten talking about our case study. For our case study, we're talking about Graves' disease and everything related to it. Graves' disease, otherwise known as a hormonal disorder in the thyroid, and the thyroid is in the endocrine system, and that has a lot to do with our body's functions. In males and in females, the thyroid does similar things, but not the exact same. It produces hormones that regulate many of our body's functions, but the main difference between the sexes is it regulates a woman's menstrual cycles.
A 20-year-old woman was experiencing tachycardia, or rapid heartbeat, and was feeling shaky. She decides to go to the doctor to have some tests done to figure out what was going on. The doctor drew blood to measure the levels of the thyroid hormones. The hormones T4 and T3 are hormones produced by the thyroid gland that regulate bodily functions, such as metabolism, development, and growth. Many glands play a role in the production and regulation of hormones. The pituitary gland regulates the production of thyroid hormones. The hypothalamus is also a part of this process. The thyroid hormones work together with other hormones to maintain homeostasis and feedback mechanisms.
I am Kirsten Hackney. After going to the doctor and having blood drawn, the doctor gave results stating that she had Graves' disease, or hyperthyroidism. Graves' disease is defined as an autoimmune disorder that causes the thyroid gland to produce too much thyroid hormone, leading to an overactive thyroid. Another name for Graves' disease is toxic diffuse goiter, or swelling in the neck due to the thyroid gland enlarging. This can cause the inability to swallow, known as dysphagia. The patient was experiencing this, and the doctor was also concerned if she had hypokalemia, or deficiency of potassium in the bloodstream. To help with the patient's rapid heartbeat, the endocrinologist prescribed beta blockers. Anti-thyroid drugs were also discussed, like methimazole, which is often the first choice, as the second one, propylthiouracil, can increase the risk of fulminant hepatic failure, or acute liver failure. The spiritual aspect of Graves' disease can be seen from many different perspectives. For instance, some people say that the thyroid represents a person's essential nature, and that the throat is where people express their inner strength, desires, and ability to follow their dreams. Some people also just pray to God to not have any more significant issues, and if they must have a thyroidectomy, that surgery goes well.